I'd now like to introduce Susan Tucci, Illumina's Chief Commercial Officer, for this next session. Susan?
It's such a pleasure to be here and coming off our genomics forum. So, this is a perfect time to give you an update about our commercial excellence. A little bit about me. I am an engineer by training, inducted into the National Academy of Engineering. I also hold an MBA. Prior to coming to Illumina, I spent decades in the high-tech industry, started as an engineer at HP, came up through the ranks, and ended up leading businesses based on technologies that I helped to create. But really, the pinnacle of my career has been the last 10 years here at Illumina. I spent about 9 of those years running product development. And there, I had the benefit of working with our incredible scientists and engineers, always driving innovation, but also bringing everything I'd learned in the consumer electronics industry, which is about cost reduction and integration, scalability and manufacturability and user design. And it's been a pleasure to be able to bring, some of my knowledge to expanding our product portfolio. When Francis asked me to take on as Chief Commercial Officer last year, it was really kind of the opportunity of a lifetime, because being able to spend more time with our customers, helping them understand about our products and technology, and really kind of exploring the impossible with them. Our customers really are the change makers, the drivers. So it's been fantastic, and look forward to telling you a little bit more about that. As far as our commercial organization goes, we are very unrivaled in terms of our scale, our depth of expertise, our experience in taking these transformative technologies and getting them into the hands of our customers in every corner of the world. And in fact, as we were launching the product at the Genomics Forum last week, we had members of our commercial team getting trained on all of the specific elements and features and functions and the service and support of our instruments. And now they're setting off on what will be tens of workshops and road shows throughout every corner of the world. So the engine is now in place, and we're going to get this technology into the hands of our customers. We are really the market makers of the industry, and I don't say that lightly. If you look at the major inflection points in genomics that have driven growth and scale in samples and new applications, and really have come with the launch of our products. And here we are kind of doing that again with the NovaSeq X series. Last week, as you heard, we had a sold-out event at our Genomics Forum. We also had a sold-out event at our Genomics Health Strategy Summit, which is kind of our next PopGen Summit with everyone in person. We had about 130 people there. Our customers ask us to make introductions for them to other people who are running big projects or running new applications. They trust us. They see us as the center of the ecosystem. And I had the absolute pleasure of making the first calls to some of our biggest and most prestigious customers and tell them about the NovaSeq X. And I was doing that in just the days leading up to the formal announcement. And with those customers, as we always do, we were kind of discussing what would they do with this new capability. What new applications? How can we grow samples? What's next on their kind of vision for their institution? And all of those first conversations led to sales, and I can't wait to share some of the quotes from them. But really kind of seeing, their minds wide open on what is the possibility now that they have this incredible horsepower and this incredible performance at a cost structure that makes their dreams come true. We're also now leading into kind of this next generation of a multi-year adoption cycle of this new technology. And we've seen this, and I'll show you the comparison with kind of how we saw NovaSeq 6000. We actually think this will be more accretive and kind of a bigger benefit to our business than ever before, because we still have clinical customers who will be adopting and scaling NovaSeq 6000s and now the 6000 DX on the applications that they already have validated. They may not take the expense and time to validate them on a new instrument. So we'll keep cranking away on current set of applications, keep scaling those, and our clinical customers will then bring on the NovaSeq X for new assays, new applications, ones that have much deeper depth and have kind of broader multiomics content, and they will it will grow the adoption cycle in that way. Typically, research customers go first. Clinical customers will bring it on for new assays, new menu, new tests. And then there will be a whole new range of applications. These are the large-scale projects that we're waiting for us to release our next major offering. And these will be sample sizes in the millions. And so, at the end of this adoption cycle, the high-throughput market will be bigger than ever, and we will have created kind of that next major inflection point in the industry. And how do we do this? Well, we have a huge organization across the world. We've invested billions of dollars. You could think about, what does it take to create the commercial reach that we have with more than 2,000 members of our commercial organization? What does it take to create all the factories and the scale? We have 6 factories around the world. We have more than 500,000 square feet of ISO accredited, kind of FDA certified factories where we can produce our clinical products. We have 19 distribution centers across the world so we can get that last mile closer to a customer. And, that was really beneficial because when, Shanghai was shut down, for instance, during the lockdowns in China, we were able to get product into Beijing and get distribution through the country through that channel. So our, commercial reach and our footprint has come through the investment of $1.4 billion. And that's not just in the factory space, but if you think about all the precision tooling that it takes to create our flow cells and all the components of our products, our reagents, scale up our FFNs, we have verified, validated, clinical grade technology across all these factories to produce our products at scale. And that's how we can ship more than, 1 million kits a year. We can ship thousands of instruments a year with high quality and continuous supply to every, region of the world. And I should mention also that we are increasingly opening up what are more kind of commercial sites. We call them solution centers. And these are in geographies where we see the opportunity to expand the commercial footprint, to be closer to our customers. They typically, although they're mostly commercial offices, we have labs where we feature every single one of our instruments and our workflows, and we train customers on the technology. It's a big deal when we open up a solution center. Recently, we've opened them in Brazil and Dubai, and recently in Milan. Because it shows our commitment to customers in the area. We have like big launch events where we open up our doors, and I had the benefit of being in Brazil when we opened our office there. We had more than 100, actually near 150 customers show up for our launch event, and they were thrilled to see our investment and our kind of staying power in the region. We have more than 9,000 customers, and the sentiment from our customers, as shown by our Net Promoter scores, is that they trust us. Customers trust us. They buy into their technology. They buy up our product line. Our Net Promoter score at 54 is excellent, not just in our industry, but across any industry, and it keeps getting better. We're highly invested to being a customer-centric organization and having that trust and that loyalty with our customers, and it shows. Our customer growth has been very significant. We've had 45% growth in our customer base since 2019. And our instrument install base today is more than 20,000 instruments across the world. Those instruments are increasingly going into clinical applications, as you heard from my colleague Phil Febo. So 6,800 of them are used in clinical applications. The high throughput consumables going into our clinical applications are also growing. So if you look at kind of who's purchasing that incredible franchise of our high throughput consumables, just 5 years ago it was less than 30% clinical, and now it's 43% clinical. And those clinical customers typically have much more kind of sustained needs. They're growing their test, not only number of tests they do, but their test menu. And so we see them as a big growth driver of the future. Our customers also want to have a relationship with us. That was true, as I mentioned, in our customer event. And, if you looked at the tweets and the social media and how excited they are to be, part of the Illumina ecosystem, but also in the fact that they connect to us through our proactive kind of connectivity, which means that we can be monitoring the performance of their instruments and ensuring 100% uptime. It also means that we can see if they are stalled in runs or if there's something going on, and it gives us a very good understanding of kind of continuity of our business and where we might have issues and need to put more focus. It was certainly very useful to us during the pandemic when we saw kind of the downturn in runs and we could see exactly when they were coming back up. And it is not only, a great tool for us to kind of drive our business, but also a feature for our customers. And customers are, that rate of customers connecting to us keeps getting higher. Next year, we're going to look at auto replenishment through this means, because customers want to have a continuous supply. Sometimes they don't want to carry the inventory, but they want to know they get the consumables when they need it. And for us, that makes all the sense in the world. It drives efficiency, and we can kind of count on that consumable stream with those customers. And if you look at the quotes, oftentimes I visit customers all the time. I'm on the road all the time. Last week was great because they came to us. So I saw all of our customers without having to leave San Diego. But typically when I'm on their sites, they are so excited to introduce me to our field application scientists and field service engineers who are resident at many of our largest customers, actually have our employees sitting with them in their labs, making sure their instruments are running and that consumables are flowing. And so they introduce them as kind of part of their company. They really appear like an employee of the customer, but they are well loved. And that level of intimacy with our customers is something that we really value and cherish. We're really proud to be, part of the first of programs around the world. And I mentioned last week we had our Genomics Health Strategy Summit, and this was, about 130 people. We were going to cap it at 100, but it grew to 130 people around the world who are running the big population scale, nation scale projects for sequencing, driving precision medicine in their countries. And if you think about the very first one, which was Genomics England, that did 100,000 samples, we were with them at the table from the very start, scoping the program, looking at the strategy, how is it going to work, how are you going to manage data, how do you bring in clinical samples, how are you going to get subscription into participants into this study, and then increasingly providing them not only all of the genotyping but also the sequencing. So we're the only partner who does genotyping and sequencing at the scale that these projects need. And then, of course, they count on us, and they count on us to help raise funds for driving samples, bringing foundations and other bodies and, increasingly pharma companies to the table who want to fund these studies. They count on us for the technology. They count on us making sure the technology works and building the infrastructure. Even for Genomics England, we ran the samples and we ran the lab. And increasingly, our data management is very important for this scale of genomics. And if you look at the big programs around the world, GEL used the Dragon technology for their 100,000 samples. UK Biobank used Dragon to run their 500,000 plus samples at this point. All of us, the 1 million sample project in the US, our precision medicine project, we partnered with Broad and did Dragon GATK, and Dragon was used for that study as well. So Dragon is increasingly becoming the standard for secondary analysis, and you heard all from Alex about why Dragon has highest accuracy, and you can understand why it would be adopted. And if it was even going to be a question, we've now built it into the NovaSeq X platform, so customers were delighted to hear about that. It reduces the complexity of the data management, the cost structure of data management. Often at times, it costs as much to manage the data as it did to sequence the sample, and now we can kind of reduce that barrier, reduce that cost, and drive more value and more samples into sequencing. And increasingly, they're looking for ways of doing the data sharing and the data management across all the people that they want to share data with. These studies that they do, investing in running 100,000 samples or 500 or 1 million or millions in the future, they really benefit from making these databases open to researchers across the world who drive new insights and findings, new drug targets, things that add value to this asset that they now created. And so they're looking for secure data management, and our Illumina Connected Analytics product is fairly new on the scene. Singapore Precise is a first to implement our Illumina Connected Analytics for their federated data and data sharing with other population scale programs. And we see Illumina Connected Analytics being an incredible asset for these projects in the future, and Singapore being the first one to do that. But we're driving not only the easy data sharing by having a common bioinformatics platform with Dragon, but then by having a common data infrastructure platform of secure data sharing around the globe, we're going to drive more insights and more value out of projects like this. We're really excited. The next scale of projects is even bigger. We're enabling that with the introduction of NovaSeq X. If you think about our future health, that's a study of 5 million samples. And now, with NovaSeq X, they can think about not starting as an exome project, but growing directly to genomes. And we had great conversations. In fact, we had a wrap-up with the Genomics Health Strategy Summit participants after the introduction of the NovaSeq X and really challenged them to think bigger. There are studies, for instance, one across Africa that would be 3 million samples across the continent of Africa. And that would move the needle in a major way in what is today a lack of diversity in samples that are available to the public. So we're really excited about what this new introduction is going to mean for the next scale of these programs. I want to talk a little bit about why our success in the adoption of our products, not only the development of our products, but ultimately the adoption of our products, and those becoming kind of the gold standard in the industry, is really driven by this deep intimacy we have with customers. So our more than 9,000 customers, and as I told you, we have our employees even at customer sites. We listen to our customers. We're talking to them all the time. We convene them in like the Genomics Forum, and so we have great voice of customer, really informing what we do next. And an example of that is in our mid-throughput range. So in our mid-throughput platforms, we have the NextSeq 500 and the 550DX. And what customers kept telling us is they wanted more horsepower. Multiomics is really growing. They want to be able to run multiomics samples and really understand kind of the biology to a greater depth. They want to have higher output per sample, because if you're doing multiomics and if you're doing any clinical application, you need to have more output. They wanted reduced cost per G. They wanted faster turnaround time. And all of these things led to the NextSeq 1K, 2K platform. And the NextSeq 1K, 2K was also the first in which we built the Dragon technology directly into the box, reducing all that overhead of data processing. And so the NextSeq 1K, 2K, as a result, has allowed us to grow our mid-throughput offering. In fact, it didn't really replace the NextSeq 500, because especially the 500, the 550DX has a huge clinical menu now built on it. So we keep scaling in the NextSeq 550DX while adding the NextSeq 1K, 2K, which has really been the fastest adopted mid-throughput platform in the industry. And you can see, ways that we do that, not only kind of building the product based on voice of customer, but also kind of convening customers into really understanding how to utilize the technology. We held a multiomics symposium. We had leaders in the field, the most respected and prestigious, researchers who talked about how to do multiomics studies. We had 4,000 participants who kind of partook in those studies, in those webinars. And really, it's that, loop of building what customers want, training them on the technology, building the application space, and kind of then growing the adoption of the technology. And I think the mid-throughput has been a great example of that. And they also want to know that the investment that they're making has longevity. And so, introducing new offerings based on the capital that they've invested in, like we did with the long read kits, for the NextSeq 1K, 2K. This was a huge and popular product for that community. Many customers who were holding on to their MySeqs, because that was the only platform that did the 2x300 long reads, are now able to step up into 1K, 2K and to have the horsepower that comes with our mid-throughput series. And so the offerings for the long reads, and then we just announced that we're going to take the XLEAP chemistry and put it on the 1K, 2K. And this will be available in the first half of 2024. This was met with a great applause from our customers who have invested in the 1K, 2K or are on the crux of investing into this platform. It gives them the ability to have 500 G of data on the same system that they purchased that was capped at 360 G. So it gives them a whole other range of applications that they can bring onto the 1K, 2K. And of course, our biggest announcement, which we made recently, and that is the NovaSeq X. And, once again, that customer intimacy, the voice of customer, we delivered something that was truly beyond what customers expected. They expect us to deliver, higher throughput and, get to kind of higher levels of output per run and lower costs. But to address all the sustainability issues, I think it kind of blew them away. And that, that is what we heard from them. So talking about more flexibility, the NovaSeq X series has two flow cells. The X Plus has two flow cells, and there's the X model, which has one flow cell, can later be upgraded to have a two flow cell version, which is in the X Plus. And each of those flow cells, the highest output flow cell, has 8 lanes. Each of those 8 lanes can be addressed separately, which is, huge flexibility for our customers, because they can kind of pool libraries, for any one lane of the flow cell. It means they need fewer indexes and, can kind of manage it a lot easier for their workflow, run different applications in each lane of the flow cell. Huge flexibility, huge kudos for that. Of course, customers asked all of last week, so is it locked for applications like the X10 was? We can only do whole genomes? And the answer is no. You can run any application. Any application you can load onto the flow cell. If you want to do millions of microbes, go for it. The other question was, because our SBS chemistry is absolutely the standard in the industry, the entire ecosystem of applications, as you saw from Alex's slide, all of these multi-omics applications, many of them from partners, have been built on SBS chemistry. So the question was, can our libraries work on the new XLEAP chemistry? Will our adapters work? Will our indexes work? And the answer is yes. You can port over all the applications that you run today, all the applications that the world of genomics has built, you can port them over to our NovaSeq X, and that was a huge kudos as well. And then, of course, kind of maximizing their ROI and making sure that this is going to be efficient and scalable and help them run their business. They were pretty blown away by the fact that we built in, as you heard, a supercomputer. We built in the Dragon FPGA, 3 times the horsepower, a lot more flexibility, and yet it's the same size and footprint as a NovaSeq 6000. It has the same power requirements, the same heat management and venting requirements. So literally, they can do a one-for-one replacement in their infrastructure of something that has 3 times the horsepower. And this is huge because, having to think about new connections and new venting, if you visited on any of our customers that have 20 NovaSeqs or 30 or 40, they have had a substantial investment in that infrastructure. And having to control the environment differently or building a whole new facility is a slowdown and a cost and a hassle that is very difficult. So being able to do drop-in replacement was huge for them. And then, of course, building in the bioinformatics. So when you're talking about doing data processing, when you're cranking out 16 terabases of data, it's huge. And even if they don't use the Dragon pipelines that we're going to have available and we'll be regularly updating on the product, just being able to do BCL to FastQ conversion and then taking a FastQ and doing compression on it automated in the system is incredible. And so all of a sudden, like all of the complexities and hassle, when we were talking to programs that were conceiving of millions of samples, they kept saying, well, we're going to have need for like football fields and NovaSeq 6000s. It's like unachievable. It can't be done. Just operationally, we can't get to it. All of a sudden, once again, we've solved that problem. So we should see these sample sizes increasing, people being able to dream big on what they can do. And of course, the sustainability. They did not expect us to reduce like the entire cold chain requirement in shipping our consumables to them. Our customers that have fleets of NovaSeq 6000s, when they receive consumables for us, it's a big event. They have to stop what they're doing. They have to take the entire team that runs the lab, and they're receiving boxes and unpacking them and like dealing with dry ice. And now we've reduced all of that. And so it is a huge efficiency for them. It allows them to scale faster. It's a huge cost reduction. It allows them to keep their staff busy doing what they do best, and that is to kind of run genomics and run our multi-omics applications. And of course, our customers are scientists, they're physicians, they care about the environment. So reducing the environmental impact of doing big science and doing big precision medicine is incredibly meaningful and important to them. So when does it launch? When is it available and in what models? I mentioned the NovaSeq X, which is going to have a list price of $985K. It's basically what NovaSeq 6000 is. NovaSeq X Plus, which is $1.25 million. The first product that will launch is a NovaSeq X Plus in Q1 of next year. Next year, we expect about February when we're shipping product. And then the NovaSeq X will come in the second half of the year. All the flow cells, the first flow cell that's available is in Q1, and that is comparable at 3 terabases of output. It's comparable to our high output flow cell or our S4 flow cell on the NovaSeq 6000. Comparable, but it runs twice as fast. That run for 6 terabases takes 24 hours compared to like 44 hours on the NovaSeq 6000. So twice as fast, so they can turn around a lot more samples and be efficient. And it's about 35% less cost per G. Across the lineup, customers are going to get between 30 to 60% cost reduction if they're adopting the high output flow cell on the NovaSeq X Plus. So that is the 8 terabytes flow cell. They're going to be able to get to $2 per G, which is a 60% cost reduction from what they have on the high output of NovaSeq 6000 today. So incredible offering, incredible compelling price points, and customers were asking all the right questions last week and thinking about how they adopt this technology. So we are very confident that we're going to catalyze this next wave of new samples and growth in the industry. We're hearing it already, all the things that we were thinking about internally in our four walls before we started to have the first customer conversations. Things like driving from exomes to genomes. We're making that completely feasible, cost-effective, efficient to do from a data standpoint. Going from bulk RNA experiments to single cell experiments and to kind of scale up the number of cells. Going from single method applications to every sample really being a multi-omic sample that gives much richer understanding of the biological content of that sample. For clinical applications, getting to greater depth and all of these things, greater depth, allowing for going, to genomes, allowing to going to multi-omic study, adding proteomics, for instance, in clinical samples, adding methylation, all of the things that lead to greater clinical utility, greater evidence generation, all of the new applications that Phil so eloquently talked about that are going to make a difference in patient success and patient impact. And then, of course, new types of samples. We have a number of customers in the pharma space that want to do high-throughput screening studies. They want them to be statistically powered. Now they can get to higher and higher powers of statistical confidence, build their models, build their imputation engines, and do that, efficiently on the NovaSeq X series. And of course, I talked about the population studies that are going to get to bigger and bigger sample sizes. If you think about where we are in this industry, we really are still at the very beginning. And I know we show these numbers all the time, but we live it and breathe it. We hear it from customers. We are at the very beginning. If you think about the number of species that are sequenced, it's thousands. If you take your gut microbiome alone, it's millions of species, and we want to understand that for better health. If you look at the number of humans genomes that have been done, it's less than 4 million. Now we're talking about projects, each one alone, that's going to be in the 4 or 5 million sample size. And if you look at the number of variants characterized, today it's less than 1%. We need to get as close to 100%, at least, of the known variants today characterized for us to lead to the health applications that all of us want for the future. And so we think there are massive projects on the horizon. We're going to drive this incredible inflection point once again in the industry, and this is the start with the introduction of the NovaSeq X. We are confident, having done this time and time again, that there is an elasticity model that we really experience every time we have one of these introductions. We bring the cost down, but the growth of output far outweighs the cost reduction, and we see a financial growth and a business growth based on that action. So this is the experience with the NovaSeq 6000, which we launched in early 2017. We brought the cost of sequencing down by 70% over this period. At the same time, we had a 500% increase in the amount of data that was produced. So we're confident that we're going to experience another cycle just like this with the cost reduction that we made with the X Plus, and of course the complexity reduction that we made. Just talking about the adoption cycle and comparing it to the adoption of the NovaSeq 6000, we think it will be similar to that, but I think we're going to have a longer tail of high throughput, volume usage of our 6000s and our 6000 pluses. So in the first year, we see the research customers, they all want access to the new technology. They're applying for grants. They want to be competitive. They want to get more for their research dollar. So they're the first to kind of make those purchases. But our clinical customers will also be interested in getting their hands on it, to do tech dev, to start building their next series of assays on the new technology. And then over the course of several years, in fact, we're year 6 in NovaSeq 6000, and we still see customers, even as of last week, scaling in 6000s and now in our 6000 DXs. So we'll see kind of a long cycle here where the consumables for 6000 will continue to be strong, especially in the clinical applications, while we're ramping up into the X Plus for several years to come. And our customers agree. And here you see the first customers that have placed orders with us. And once again, these were just the personal conversations that the reach outs that I made over the course of several weeks. Eric Liftovsky, who's CEO of Tempus, who absolutely wants to get hands on this technology. And once again, this is kind of for future applications and scaling their clinical operation. Kari Stephenson, I love his quote. He's the founder and CEO of Decode, now owned by Amgen. But going from sequencing populations to sequencing whole nations, and we're absolutely going to see that with this introduction. Professor So from Macrogen, who has been a proponent of whole genome sequencing really since the start of the industry, and he was blown away by this capability and the introduction and what it's going to mean for the growth of Macrogen, their ability to bring whole genomes throughout the world. Eris and John Overton from Regeneron. Once again, they have an incredibly efficient insight engine that's driving to new, drug discovery, new drug targets, and they can't wait to get their hands on the NovaSeq X and be able to kind of power their statistical studies. And then, of course, Stacey Gabriel from the Broad, and the Broad is a launch partner as well. All of these are launch partners with us, and of course, the Broad will scale their research applications. They're looking at how they take exomes to genomes and get to that next level of scale in their, incredibly respected institution around the world. With that, I hope I've convinced you that we have an unrivaled, incredibly powerful commercial engine that's going to take this technology, like we've done time and time again, and drive adoption around every corner of the globe. that we are the market makers, and here again, the market is abuzz because of our introduction, and that we are going to be sitting down with all the change makers in this industry and talking about how we drive the growth of samples and the growth of clinical applications. And of course, that this new technology, this new chemistry, this new capability is going to drive another inflection point in growth in our industry. With that, thank you very much. And it is my pleasure to introduce my colleague, Joydeep. Joydeep is not only the head of strategy at our company, but he's also our interim CFO. So, Joydeep, thank you.
Good morning, everybody. Pleasure to see you, and thank you again for your time. So, Susan mentioned, I've been here for about 3 years. Really came to Illumina attracted by the potential of our technologies and our infrastructure to impact human health in the next decade or more. Prior to Illumina, I served with Thermo Fisher for about 16 years, so really a long time in the life sciences industry. At Thermo Fisher, I led P&Ls for various businesses, including the clinical oncology division, and also several geographies, including the Asia-Pacific region. Prior to that, I was a consultant at McKinsey & Company for about 5 years, really focusing on pharmaceutical R&D and R&D productivity, and several large private equity deals where we were assisting these clients. So I want to take the next 25 minutes or so to weave together the various themes that you've heard from my colleagues into our long-term financial picture. So in terms of my key messages, as you've seen, we have a proven track record of delivering profitable growth, driven by our emphasis on innovation and, of course, on operational excellence. As we look forward, we see significant opportunities in several large, growing, and underpenetrated markets. Coupled with our leading technology, we expect to deliver mid-teens revenue growth over the long term. In addition, we expect to deliver high teens operating profit growth, really driving towards disciplined pricing, capturing economies of scale, and of course, continuing on our discipline around strategic cost management. And lastly, our disciplined capital allocation framework will allow us to make investments on both organic and inorganic fronts to build our sustainable market leadership and unlock new applications for genomics. Turning a little bit to our past track record, so as you've seen, we've delivered strong revenue growth on the back of our launches such as NovaSeq and our entry into clinical markets, and all of this despite the headwinds that were provided by the pandemic. On the gross margin front, we have continued to deliver gross margins in the 68 to 71% range, really delivering, again, very disciplined pricing, consistent innovations that drive down our cost of goods sold, and continuing to deliver manufacturing productivity, while at the same time continuing to reduce prices for our customers. And we have delivered operating profit growth that has exceeded our revenue growth, again, focusing on economies of scale and continuing to extract operating leverage while being very deliberate in continuing to invest in our R&D and our commercial and clinical infrastructure. Now, turning to our overall customer base, as several speakers have mentioned, we have a large and diversified customer base. About 50% of our revenues now come from outside the United States. On our end markets, we continue to drive greater participation into these clinical markets where our products are increasingly spec'd into our customer workflow. So these include our instruments, our consumables and reagents, and our software. And these have led to our clinical business growing at almost 25%. Our install base, again, driven by our innovative technologies, has continued to expand rapidly. And this, coupled by strong pull-through in our instruments, has led to a recurring revenue that today accounts for about 80% of our total revenues. Now, for the long term, we expect to deliver mid-teens revenue growth, really driven by our innovation and continuous expansion into large growing markets. In the short term, though, in 2023, we do expect some moderation of this growth, driven by some of the macroeconomic headwinds that we are seeing and some expected typical supply constraints on our NovaSeq instruments for the first few quarters. Again, as I mentioned, this is very typical of large instrument launches as we see initial interest and demand in these outstripping our ability to supply them. We expect, though, that these headwinds will be overcome by the end of 2023. Turning to gross margins, we expect to continue to deliver gross margins in the high 60 to low 70s range, again driven by economies of scale, continued focus on innovations that drive down cost of goods sold, and in terms of leveraging manufacturing efficiencies. On the operating profit side, we expect to continue to deliver high teens operating profit growth, again driven by capturing economies of scale, while maintaining our ability to invest in R&D and commercial infrastructure. We dive a little bit deeper into each of these elements. So as Francis and others have mentioned, we participate in several very large, growing, and underpenetrated markets. Our technology innovations that Alex and Phil and Susan talked about enable us to drive the adoption of NGS into these markets. I want to emphasize this penetration is not just on genomics, but increasingly in the multiomics arena, where NGS is now delivering the ability to assess not only DNA, but RNA and proteins and methylation at scale. It's really the innovation, the change that we're driving. We expect that these markets by 2027 will reach about $120 billion in size. I guess this is a chart which a lot of you have been waiting for, so let me spend a little bit more time on it. So path to our mid-teens growth. And really we look at four different components to it. Not surprisingly, the first part of that is really around consumables demand elasticity. The second component is an expansion around the workflow participation. The few areas in terms of mitigation of to growth that we will talk about. And then lastly, you have to adjust it for growth on instruments, services, and arrays. Let me click through some of these in turn. So on the consumables demand elasticity, we see three areas here. The first one is, of course, the increase in number of samples. And again, this should be familiar to you by now because participation in some of these large markets, especially around clinical demand, driven by markets such as MRD and minimal residual disease screening and screening, early disease screening, including oncology, really are driving a demand for more samples, but longitudinal testing of the same patients multiple times over their lifetime. Other areas that are increasing the number of samples include, as Susan was mentioning, right, a demand for larger population genomics cohorts and larger clinical cohorts, which are often driven by the increased interest of pharmaceutical and biotech companies in using genomics, and of course increasingly multiomics, into their drug discovery and development processes. And of course then, new technologies or new techniques such as single cell and spatial are also increasing the number of samples that are analyzed through our instruments. Number two on the consumables demand elasticity is really an increase in number of samples per analysis, or rather number of analyses per sample, I'm sorry. This is really being driven by a move towards multi-omic analysis of the same sample. And again, that in turn is being facilitated and enabled by improvements in our technology. So of course, one clear aspect of this is a reduction in the amount of sample that is required for each of these analyses. And Alex talked a little bit about that, which then allows you to do more analyses of the same, often limited sample. The other place that our innovations are driving more multi-omic analysis, the capability to do multi-omic analysis, is innovations that are built into our instruments and consumables, right? So Alex, I think, talked about the ability to run the same sample with different multi-omic analysis and the same sample on the same chip at the same time, right? This is impossible to do with any other technology existing in the market. And this, you can see how it enables you to open up these markets now and drive towards this. So you're going to start seeing things moving from just analyzing DNA to simultaneously analyzing DNA plus RNA plus protein and so on. So we do expect a strong increase in the analyses per sample. And the third area is really around increasing intensity of sequencing, right? So as you drive down the price of sequencing, as you enable more sequencing at scale, you are going to see more gigabase of output per analysis. Let me give you a few examples of this, right? So as you move from a small panel to a complete genomic profile of a sample, the intensity of that analysis, the intensity of output increases by about 5-fold. As you move from this comprehensive genomic analysis to whole genome sequencing, which Susan pointed out is increasingly what customers are looking at, that output per sample increases by another 40x, right? And then if you move from, solid tumor DNA towards liquid biopsy, which is again a very big transition in the field, and you're hearing it from a lot of our customers, that's about a 12 to 15-fold increase in the output from a sequencing run. All right, moving towards greater workflow participation. So a lot of the investments that we are making in addition to our core technology, as Alex was pointing out, is really to provide more value and more options for our customers around the workflow, so upstream and downstream of the sequencing. On the upstream side, there are developments in library prep that are making it easier for our customers to accurately prepare their samples for sequencing. Downstream, there's been a lot of work around software, around bioinformatics, which is making it easier to extract insights from the sequencing that comes off our instruments. In particular, as Alex mentioned, we are focusing on a few key end-to-end workflows that really will enable our customers to do a lot more from their sequencers. This includes the examples that we have pointed out on proteomics, which is really bringing proteomics, multiplex proteomics to our customers at scale, and products such as TSO 500, which allow therapy selection for a distributed customer base, again, at scale. Touching on a few of the headwinds that will moderate our overall revenue growth. So, of course, probably the most important of these is price. But here, as you have seen, we will maintain our commitment to drive price down for our customers and continue to drive demand elasticity for our customers. We also expect, given the attractive market we are playing in, that there will continue to be new entrants coming into the marketplace. We intend to stay ahead and lead the market in new technology, though, with our investments in R&D. We also expect our customers to continue to drive productivity in their own operations, right? So this will reduce the amount of reagents they use per experiment. And lastly, as I've talked about, some macroeconomic headwinds. Moving to the non-sequencing consumable part of our business, we expect high single-digit growth for our instruments, arrays, and services over the long term. All right, let me hit a few things around the operational excellence and our gross margin and our operating margin. So as I mentioned, we intend to maintain and expect to maintain our gross margins in the high 60s to low 70s range. We will achieve this through disciplined pricing, innovation that continues to drive less expensive materials, improved processes, and greater productivity. Some of these include things like automation, process automation, and standardization that will continue to drive costs down through lower rework costs and lower standard costs. We will continue to capture economies of scale in our operation and continue to drive a more diversified manufacturing base that allows, and more insourcing that allow us to further reduce our factor costs. On the operating margin side, we're committed to delivering high teens growth in our operating profit by capturing economies of scale while maintaining our investments in industry-leading R&D and commercial infrastructure, especially around clinical and solution selling. We intend to capture or reduce our cost to serve through our highly connected instruments that Susan mentioned, and also through investments in e-commerce. And of course, we will continue to drive scale in our G&A expenses. We move to capital allocation. There are three areas we're focused on in capital allocation, and of course, our primary focus continues to be on organic investments in R&D and commercial infrastructure. And I'll come to this in a little bit more detail in a little while. On the M&A or inorganic front, we intend to continue our investments in key licenses and bolt-on acquisitions that will allow us to continue to deliver IP-protected, differentiated technologies faster to our customers. And lastly, we continue to intend to use share repurchases as the preferred mechanism to return capital to our shareholders while maintaining an investment-grade debt rating. We focus a little bit more on our organic investments and reiterate some of the things I've said earlier. So first of all, on the organic investment side, we intend to continue to maintain a high degree of investment as a percentage of revenue on our R&D infrastructure. This will allow us to continue to accelerate the frequency of our new platform introductions, as Alex had mentioned, to continue to advance our innovation roadmap with a focus on sustainable IP protection. And of course, then it will enable a continued investment in our clinical and medical infrastructure that are necessary to drive adoption into the clinical markets. On the On the sales and marketing front, again, our intent here is to continue to maintain the strong investment that we have had here to develop the kind of differentiated infrastructure that Phil and Susan talked about, while continuing to extract economies of scale and reduce the cost to serve. So in particular, the investments that we're focused on here are around geographical expansion into fast-growing emerging markets, continuing to expand the investments in our clinical and in our infrastructure to serve pharma and biotech customers who are increasingly adopting genomics into their drug discovery and development processes. And lastly, continue to invest in areas such as e-commerce, instrument utilization tracking, auto replenishment, et cetera, to continue to reduce our cost to serve. So with that, let me wrap up with leaving you with a few key messages. So, we definitely play in very large, growing, and underpenetrated markets, which then coupled with our technology leadership and our commercial infrastructure leadership will allow us to deliver mid-teens growth in the long term. We will deliver high teens operating profit growth in the long term, really focusing on economies of scale and strong strategic cost management while continuing to invest in our R&D and commercial capabilities. And lastly, our disciplined capital allocation framework will allow us to provide both organic and inorganic investments to build sustainable market leadership and to unlock new sequencing applications. So with that, I will conclude my presentation here and ask Sally to come up and set us up for Q&A. Thank you.
Thank you, Joydeep. While we're assembling everything up here, let me just give a few updates to you here. First of all, we're going to post the slides from today's presentation, so you don't have to write down everything that you saw or remember it. They'll be on our website at investor.illumina.com. We've also included, for your reference, a glossary at the back of the deck for all the many acronyms that we've used here today. And then for Q&A, a few instructions for everybody here in the room. If I could just ask if you would please just raise your hand if you have a question, and then if you could wait for the microphone to get to you so that everyone on the webcast can hear your question as well. For those that are participating virtually through our webcast, you can submit your questions on the Q&A box that's on the right-hand side of your screen, and we're going to try to work in some of those questions as we go. We're going to do our best to get to as many questions as possible here, so I will ask that you please just limit yourself to one question without multiple parts so that we can give more attendees a chance to ask questions. So with that, we're going to go ahead and get started, and I'd like to first just welcome our speakers to the stage. Well, we're going to go back here with this, right here with these two gentlemen here with their hand raised in the middle. To your left, Natalie.
Thank you. Luke Sergott, Barclays. So we'll just start out here when we're thinking about, I know we're not talking that much about GRAIL, but can you just update us with the litigation roadmap, when you expect the timing of the EC, whether they're going to hear the trial, and then how that framework works within your 9 to 18 months? And then more strategically, as you guys have done vertical and horizontal M&A, and both of those have been blocked, give us an update on how you're thinking about that strategy and continue to unlocking these overall markets.
Sure. So let me take a cut at that. So let me start by laying out the time frame. So we expect the next step to be from the European Commission. We'll get the prohibition order, which we expected. We got the prohibition order. We expect the divestiture order to come out at either the end of this year or very early next year, and that'll lay out a time frame for the divestiture. So we're waiting to see what they come up with. You can expect it to be. They want it to be in an orderly way, and so it'll be sometime 6 to 12 to 18 month kind of time frame. But again, it'll be laid out in the divestiture order. We also have in parallel going on our appeals to the European Court around the jurisdiction order, and we're appealing the prohibition order. We expect the appeal for the jurisdiction to play out in the back half of next year, so it'll go on in parallel. And so what I was talking about was, we have started our own work stream to evaluate strategic options for Grail. And the time frame I laid out was just based on our observation on the typical time that kind of process takes. And so that's sort of what's playing out in terms of time frame. In terms of our M&A, we have seen obviously the regulatory challenges around Grail, and then a few years ago when we did PacBio, we saw similar regulatory challenges. In between, however, we've done around 5 deals that we've been able to close. And so what we're seeing is that we're able to do the technology tuck-in type of deals that we've now built into our product. So the lossless data compression, for example, that's built into our NovaSeq X came from an acquisition. And so we're seeing success with technology, sort of tuck-ins and that kind of M&A. Obviously, there's more scrutiny now on bigger deals, would be our observation going forward.
Great. This is Dan Brennan from Cowen. Thanks for taking the questions. Maybe I just wanted to, just on a near-term question on 23, since you commented slightly below, just wanted to understand what slightly means or moderately. And then when we think about the comments that you made on the kind of on the product cycle, could you give us a little more flavor, kind of what's baked into that long-term growth rate in terms of NGS consumable growth, which I think will help us get a sense on this demand elasticity, kind of the level of upgrades. Is it going to be similar to how we saw the NovaSeq upgrade in terms of existing customers? I know you gave a lot of color at the time, and then also share loss. Are you assuming any share loss in these long-term assumptions?
Yeah, I can. Let me start off on that, right? So when we're still, obviously this is not the time to give exact budget guidelines on 2023, right? So we're going to do that in February. But we do see, the macroeconomic headwinds that we all of us are seeing in the markets, right? So that we're assuming will take a few points of our growth for next year if they continue, right, and they continue to worsen. But again, I think that is a temporary thing. We've gone through these cycles before, right? So in the perspective of the long term, for 2023, we wanted to clarify that was one of the things. And the other thing that we mentioned as well was the initial, maybe a few quarters where the interest that Susan mentioned on NovaSeq X would outstrip the initial ability to serve and service that backlog. Again, what we typically see is by the end of the first year, so by the end of 2023, we'll have outrun that and we'll be back in kind of delivering the demand that our customers have quarter over quarter, right? So that was the first part of your question, I think, right? The second part you talked about in terms of elasticity of demand, right? And there, I think it's important to remember the 3 things that we talked about, which are driving that elasticity of demand, right? So we do, and we are starting to see, and have continued to see, right, that these new applications are driving the number of samples that are being analyzed. One of the first things we saw with multiple of our customers was also that second piece, right, where the number of analyses per sample, so this drive towards multiomics that you're seeing not only from us, but from other companies in our space, right, really being enabled by some of the innovations that we're doing. So we are expecting an acceleration, actually, in the amount of number of analyses per sample. And then the last component of that was what Susan had pointed out, right, that throughout the history of sequencing, we are seeing that as price comes down, as people get more comfortable with sequencing, the output per analysis continues to increase, right? So if you take a look at those, I mean, I put up some numbers in terms of the fold increase expected in that, right? So those are well within the kind of increases you're expecting on each customer kind of moving towards more analyses per samples or having a higher output as they move towards things that give them an even bigger insight on the biology of what's going on in that sample or that patient.
Yeah, and then another thing I add is you should expect a similar sort of multi-year upgrade path like we saw with the NovaSeq 6000. That, because this is going to be one of the largest upgrade cycles in the history of high-throughput sequencing, and we have a big install base of NovaSeq 6000s and still some HiSeqs. And so you should see this be that sort of 5-year upgrade cycle that we saw last time, initially led by the large genome centers and research institutes, and then we'll activate the clinical part of the market in the following years.
I'm going to quickly take a question that we've had come in from online. This is from Vijay Kumar at Evercore around margins. So he's asking, margins have come down from the high 20s, to the low teens. What's going to get them back to historical levels for core Illumina? And then will the rollout of NovaSeq X have any gross margin implications for 2023?
Yeah, so on margins, right? So in the long term, we have seen margins come down. Part of this was, investing. We retooled our R&D investments to allow us to deliver ever faster product innovation introductions, right? So we do expect that, as we complete that, economies of scale, both on the R&D side, but also on our G&A and our commercial side, will drive, coupled with growth, right, will drive the operating margins higher. So as we model this into our subsequent years, we do expect the high teens operating margin growth that I talked about earlier. I'm sorry, I'm forgetting the second part of the question.
The second part was NovaSeq X and any impact on gross margins for 2023.
Yeah, so I think on that front, right, as Alex talked about, we have driven a lot of innovation to make sure that, and as we traditionally have done, right, that our ability to deliver lower prices to our customers are underpinned by innovations in our COGS and all four of the specific instruments. So one specific example that Alex referred to was, the ability that we have taken a chip that was already pretty efficient with NovaSeq 6000, and we've tripled the capacity of that chip, the same chip, and even made it smaller. So things like that allow us to reduce the amount of cost, plus the standardization of processes that we have talked about. So we do expect to maintain our gross margins in the high 60s to low 70s as we transition to NovaSeq X. Year on year, mix also drives the margins. So in years in which there are more instruments sold than consumables relatively, you will see a small dip in margins, but that quickly corrects as the consumables demand catches up.
Okay, let me come here, Patrick. Let's see.
Great, thank you. Patrick Donnelly from Citi. Maybe a follow-up on that margin question. You guys talked a lot about the R&D engine. Francis, you called out, I think, just short of $900 million to spend last year on R&D. I guess, given NovaSeq X is coming out, you didn't call it out as an opportunity on the margin side, but how do you think about that spend going forward? Is there opportunity to refine, optimize that? Maybe just talk about kind of what goes into that spend, how you think about the ROI. And then I just want to follow up on Luke's question on the Grail piece. You kind of mentioned the divestment order could come in a month or two. The appeal is another year. During that time in between, is it more just kind of wait and see and you're going to play out the appeal process, or is there an opportunity to divest Grail kind of during that period as well? Thank you.
Sure. So let me take the first question first. So I'd say, we are continually looking across our spend profile to identify opportunities to optimize costs. So that's a continual process. There are periods when, we do scale up investment, and certainly coming into these launches, was a period of scaling up investment into R&D, because at the same time we were retooling our development process to make sure that we could, have future launches more quickly. So, that some of that work is now behind us. We will also balance that with the work that we are putting into the pipeline around future launches. So, we are the beginning of a lot of S-curves on technology between the flow cells, the optics, the chemistry, the compute. And so there's an opportunity for us to continue to drive new releases based on these new components across our portfolio. So, at Illumina, we build out 10-year roadmaps, and so every year we sort of reassess the 10-year roadmap. What's in the 10-year roadmap are looking for opportunities for future instrument upgrades that are, better, faster, cheaper, more accurate, faster. So there's some of that work going on. We're looking for opportunities to deliver end-to-end solutions that will catalyze markets. You heard about some of them today. And we're also looking at sort of next-gen technology. So that's the mix we constantly look at to see, are we set up for the future that, we know our customers want. We also look across the company, though, for opportunities to optimize costs. And there we continue to find new opportunities around G&A, for example, as we scale to get more efficiencies. And that's the mix that leads us to chart a course where we can see expanding margins, that even as our revenues scale, our costs won't scale as high, and you should see expanding margins going forward. In terms of Grail, we are going to treat these as parallel paths. So some of our path forward is going to be dependent on what comes out in the divestiture order for the European Commission, and that will sort of lay out, the parameters around what is or isn't possible at the time, and that may be in parallel with the with a potential appeal. And so, but again, a lot of it is dependent around how the next couple of months play out. The way we are approaching it right now is there are two separate work streams. There is a work stream around divestiture that we're looking at that is independent of, that's an independent path on its own, and will follow the guidelines laid out by the divestiture order.
I think, just to emphasize as well, right, on Grail, we are taking a pragmatic approach. I think there's nothing that, is causing us to elongate the time. We'll get that resolved as efficiently as possible, but, taking care that we maintain shareholder value and Grail's value to succeed, right? So just wanted to assure you this is not us looking for an opportunity to elongate the process.
Yeah, we want to get it resolved as quickly as possible.
Maybe I'll make a comment on the R&D spend, which is that the investments are not just to have the next NovaSeq X and similar type products in other categories as they're deep, and I think I said is to have more product introductions faster, right? So and to drive growth. So it's not just to maintain kind of a similar type of kind of new upgrades, but it getting more expensive. It's actually to get more products over time and actually do it in a way where each of those is less cost because we're doing more and we're doing it faster.
We go up front here. We'll go to Dan.
Thank you. So a follow-up to Dan Brennan's question from earlier. I was hoping to get more color on how you're thinking about the layered adoption cycle on the high throughput instrument side. So when you launched the NovaSeq initially, you shared that there were 800 high throughput customers. Where does that number stand today? How many are research that would want the latest and greatest technology, and how many are clinical that will be scaling out the last generation of the technology? Thank you.
Sure. Maybe Susan, we'll turn it over to you.
Sure. Our customer base for high throughput has grown, as you can imagine, and we have I don't know if we put the actual numbers out there, Sally, if you're okay with me sharing some of them, but about 1,500 customers in high throughput today, and we have about 40% of those are clinical customers. So that growing base of clinical customers. In terms of how we see that impacting the adoption cycle, as I mentioned, I think that for many of our clinical customers who will start to take on maybe a few sequencers in kind of immediately because they want tech dev of new assays, they already had in mind they're going to do a ctDNA assay. And so they're not going to develop that directly on a 6,000 at this point. They'll probably, because they want to have kind of higher depth, they want to have multiomics. They'll kind of target that on the new instrument. They'll bring the new instrument in, as you saw with Tempus, to really kind of road test and understand the performance on the new chemistry. But the thought of moving applications, and we have customers today, they're asking us to continue HiSeq consumables because of applications they had validated. So I think there will be a long tail of usage of the 6000s, and we just introduced the 6000 DX. And so for many of our markets overseas, it's going to be important to have a DX product to meet the regulatory requirements of IVDR or others. And so they'll continue to adopt and scale the 6000 DX. But there's going to be, because the new clinical applications are driving to higher intensity, to multiomics, there's going to be a deep interest in getting to the new technology for new applications as soon as possible. In general, I see that the pull-through on 6000s and 6000 DXs being robust, because these are clinical applications that they've already validated. They've done a site specific PMA or other, and they're growing those tests as they bring on kind of the next generation of applications. So I see it as being once again multi-year, but like we're seeing with the NovaSeq 6000, even in year 6. I think in Q1 of this year we had the highest number of 6000s ever sold in year 6 of the instrument.
We'll go right up. We'll stay up front here for a minute, and then I promise I'll get around.
Great. Thanks, Punisa, SVB Security. So, a rather simple but an important question. I know elasticity of demand is talked about quite a bit. If I could boil it down to, what is your expectation for pull-through for X Plus, NovaSeq X Plus at a steady state? Because if I look back last 15 years from the GA days, the pull-through has gone from sort of sub 100,000 to now 1.3 million on NovaSeq 6000. So where do you expect with a 25B flow cell where you can be on the pull-through? Because I think the question really is that with the subsequent lowering of cost per gigabase, how much leverage do you have in trying to drive the pull-through higher? And if pull-through is not going to go as higher, then is it the instrumentation install base that's going to drive the growth more longer term? So this is longer term. And then just one clarification for maybe Joydeep is does the guide include Grail in it, the long-term guide, and is the mid-teens off of a lower 2023 base or inclusive off of it?
Yeah, so let me start by talking about pull-through. And I'll start by saying, well, initially, of course, when we first launched it, as you know, with our other instruments, it takes a few quarters for pull-through to normalize to a steady state. And because we have, small n at the beginning, the pull-through will sort of bounce around a bit, but it will get to a steady state. And when it does, we do expect the pull-through to be higher, to continue that trend, as you've been saying, from the GA. Every time we've launched a newer, bigger instrument, the pull-through per instrument has gone up from the previous instrument. So our expectation is that we will continue that trend with the X once we get to a steady state. And then, it takes a while to get to a steady state with the new instrument. And that'll be driven partly by the elasticity we talked about. That will be enabled by the X as people do more sequencing, bigger cohorts, and run those machines harder than they have historically. We also do expect, though, to see, as we saw with the NovaSeq, that the X will fundamentally enable new use cases, which will bring new customers to the fold. As you recall, one of the upside surprises around the 6000 was how many new customers, new to high throughput customers, were coming to Illumina and starting with the 6000. And so what we're hearing from customers already around the X is the new use cases that it enables. And we expect that trend to continue too as we get to the X. So to your point, it'll be both. We do have an expectation on a higher throughput per instrument, and we do expect new customers to come out and open up the number of customers that are accessing high throughput sequencing because of what the X enables. So with that, I'll turn it over to Joydeep to talk a little.
Yeah, and maybe just to add one other thing, right? So remember, Alex said, and both Alex and Susan mentioned, right? This is also about twice as fast. So if you're thinking about number of runs that can be done per unit time, we are actually accelerating that, right? So we do expect throughput in the long term to continue to accelerate for all the reasons Francis mentioned, and that speed piece is an important piece to keep in mind. So you asked me about two things there. So first, does the mid-teens? No, it doesn't, right? So we're talking primarily about our core business today, and really a lot of the discussion here, or most of the discussion here, has been about the core business and our confidence in that business and the markets we play in. And then in terms of the growth, whether that takes into account a lower 23, the confidence we wanted to project to you was really on the capability for growth in the mid-teens area. So we're not trying to game it by one year or the other, right? We do expect that in the long term, we will, given the elasticity, given some of the innovations we're putting out in the market that really allow us to pull in new customers, to open up new applications, will drive our growth rate in that range.
I promised to go over here, so I will do that. Look over here.
Hi, Derek DeBrown from Bank of America. So I'm going to squeeze in a couple. But I guess the first one, you mentioned the IP of Grail, and I'm just sort of curious, does Grail have IP that's blocking of some of the other people doing early stage multi-cancer detection? And I guess how would you sort of think about that? I mean, if you're forced to divest Grail, how does that sort of IP arrangement work? And then the second follow-up is like, what are sort of the trade-in economics on people going to going from a NovaSeq 6000? I mean, if people just bought one and they do it, what's the economics? And is it possible? I mean, we talked to some scientists. I think they were interested in, would you ever make the NovaSeq 6000 backwards compatible as well?
Yes. All right. So a bunch of questions there. So let's go through it. So first of all, again, today's intended to be around core Illumina, but I will quickly answer the Grail question as well. Grail has a huge IP portfolio around their methylation-based approach to multi-cancer early detection. So 230 patents issued, 170 pending, really robust patent portfolio. At this point, they're the only company in the world doing multi-cancer early detection for 50 cancers. So it depends on, I guess, what the other companies decide to do and what approaches they sort of land on, and they'll have to navigate the IP portfolio that exists with Grail and other players. What we are seeing right now is other players show up with single cancer tests, like colorectal cancer and so on. And so I guess they have a very rich portfolio, but since there's nobody else doing it, we'll wait to see how that plays out over time. If we do spin it out, their IP is around their test for early detection. That's not something Illumina does. It doesn't sort of play out on our sequencers. We have all the IP we need for the existing sequencers we have and for the roadmap going forward, so it really shouldn't have an impact on us at all. And I'm trying to think about the second and third part of your question.
Trade-in economics for upgrading NovaSeq 6000 to the X, and then would you consider making the 6000 compatible, backward compatible?
So, Susan, maybe you can talk to us about the trade-in programs and
Sure. And remember that many of our clinical customers are not going to want to trade in because they're utilizing their 6000s on their current applications. But we do have trade-in value depending on when you purchase the instrument and how many you're kind of trading up for. I think they're in the range of 15% if you've bought kind of 6 months or previously before, and maybe 20% if you're like changing in a fleet. And if you're nearer term, then it really depends kind of customer by customer. So we want to make sure our customers are happy if they purchased fairly recently, and if they should have been in the NovaSeq X, we want to kind of make a streamlined path to do that.
This is a very similar approach to what we've done historically, right? So every time whether we launched the NovaSeq or so, taking a very similar approach to trade-ins. In terms of making XLEAP SBS or Chemistry X available, on the 6000, we'll listen to feedback on that, but it's unclear, whether there'd be a need for that given now that we've launched the X. The NovaSeq 6000 was 5 years ago now, and so again, we're open to feedback, but it's unlikely. I think people would want us to go back and make it on the 6000.
We go over this way to Dan.
Hi guys, Dan Arias from Stifel. Wanted to ask a question about population sequencing, which I think is something that Susan touched on in her presentation. Curious, how you view that going forward. There were just a slew of those projects that were sitting out there pre-COVID. COVID obviously threw a pretty big wrench in the work there, so I'm wondering whether as we subside, or hopefully subside on COVID, should we expect the lower price point to sort of reinvigorate the momentum there? Can we think about some of those coming up as press releasable, big needle-moving type projects?
Good question. Susan, maybe?
Yeah, we really believe that the launch of the NovaSeq X is a catalyzing event for those population scale projects, and even Kari's Decode has been a sequencing provider for a lot of these projects, so he's seeing the opportunity to be nation scale. We actually convened, as I mentioned, a lot of the kind of leaders of those projects last week, and many of them just want to meet each other. They want to learn from other projects that have gone before. We had the opportunity to sit down with Indonesia, UAE, Singapore, of course, that they're kind of in the phase of they're going to do 100,000 genomes in Singapore precise, but their vision is to get to then 1 million. And then they eventually want to get to 5 million plus, which is the entire population of Singapore. So that would be a nation-scale project. We talked to Patrick Tsai from Taiwan, who really sees the opportunity for Taiwan to scale up their precision medicine program with a large-scale sequencing effort. And when we talk to these groups, we're kind of talking to ministers of health. We're talking to highest levels of government officials. These are programs that are they're really important. They're kind of unilaterally, whatever side of the aisle, politics kind of supported, because they are driving forward the kind of betterment of health for the nation. We're seeing it being increasingly important coming out of COVID, and everyone being alerted to having the best access to healthcare. So we absolutely saw it last week as being, and another one I should mention is Novo Nordisk Foundation, and their project is actually not just one nation, but they're looking at 6 different cohorts that are geographically diverse. It's founded. It will be funded by the foundation, but they also want to bring in private investment as well. And they're sitting down with us, saying, "Kind of introduce us to the right people. We're absolutely, we want to work with you. Tell us how to get this going. We already have kind of the funding set aside." So I absolutely believe this will be a catalyst. The other thing I heard last week from a number of the leaders was that, well, you've taken a lot of what was troubling us away, which is how do we deal with the data. And we were going to go through this whole analysis of how do we do the bioinformatics and who do we hire, and you built it in. So that takes one complexity away. And I think the other thing that was spurring last week was to see. The UK Biobank is a good example. The hundreds of scientific publications that have come from kind of open data sharing of the UK Biobank 500K cohort. Has been really, I think it's been the most useful study so far in terms of number of publications and insights that it's driven. So I think there's also the realization of value that's being generated, kind of value in terms of scientific understanding and eventually kind of better clinical applications. So yes, it will.
Maybe just to add to your thing, there's another piece that we're hearing loud and clear, right? That's genetic diversity. If you look at what's been cataloged and sequenced right now, right? I think something like 95% or so is Caucasian populations, etc. Might be getting, but it's a very, very high percentage, right? And if you get to South Asian or African genomes, right, it is a very small percentage. It's definitely less than 5%. So we're hearing that loud and clear. I think the Novo Nordisk Foundation, but we've heard from people in India, we've heard from people in many other countries, right? So that's definitely driving it. And you look at it, there's ways to think about it as prospective cohorts, right, where you're going to recruit samples. But what we're hearing from pharma is also an interest in looking at retrospective cohorts, where the samples exist, but they're locked up in various academic medical centers, et cetera. And NashBio is a great example of this, right? These cohorts exist, but they haven't been sequenced. And innovations such as NovaSeq X really allow us to unlock the samples, unlock the data on those samples. And again, that's where it's not only just genomics, right, but they have longitudinal samples that we analyze from a multi-omic perspective. So we are seeing a lot of that interest bubble up.
Yeah, it's really important, and we're seeing different models of how to fund it. Novo Nordisk is foundation-led initially. India, Reliance Group is kind of a private company that's leading that. So and the point of genetic diversity is incredibly important. Yeah.
Right. Phil, I'm going to take this opportunity to send a question your way that's come in online. So we've been talking about all these innovations. How vital is the NovaSeq DX to expanding the clinical market?
Well, NovaSeq DX, by completing our clinical portfolio, really provides clinical labs, that ability to scale to really high throughput. And Alex had it diagrammed in his last slide, and I've talked to it. Most clinical labs can't start at a NovaSeq DX. There are some models that do that. Most have to start at a NextSeq DX is a nice way to enter. We have kits and menu with VeriSeq version 2 for an IPT, which is a sample-to-answer solution that really fits the needs for across the globe, that's CE marked. We have the TSO comprehensive for CGP on the NextSeq DX. But what we've seen for the LDTs is they often start with the NextSeq and very quickly move to the NovaSeq as they scale their operations and the number of samples they coming in. And so NovaSeq really allows them, the NovaSeq DX allows those clinical labs. And in many areas of the globe, there is increased pressure to move away from the validation of RUO products to clinical testing. Indeed, there's even some of that pressure in the United States today. Don't think the VALID Act's going anywhere this year, but certainly continued dialogue. And having the portfolio of DX to support and in parallel with our RUO is really important. And it really wasn't complete until we've launched the NovaSeq DX, which is really exciting. So it's very important.
Good. All right, we're going to go back to the middle for a little while. We'll go to Kyle here.
Kyle Nixon from Canaccord Genuity. So I want to talk about the, I guess like the path towards really like repeat multi-omic testing. So clinically, so Phil, you had that slide that kind of had the clinical demand elasticity, and now it was like a separate function downward towards repeat clinical multi-omic testing. I think now we're at CGP is what you said. Maybe thinking about this two ways. First, what has to happen for us to get there, right? So does the maybe end of the NovaSeq X series upgrade cycle kind of get us to that point? Like maybe 5 to 7 years, 2027 plus. And then number two, like what is Illumina's like strategy towards this type of repeat multi-omic testing? Like is this going to be direct, like SomaLogic, those kinds of deals, or the more of a partnership approach like kind of doing right now with multi-omics?
Just start, Phil.
Why don't I start and then hand it to Alex, because it's really his teams that are kind of building the blocks to enable this. But clinically, what we are seeing, so if we take oncology, for example, like already in TSO comp, we use DNA and RNA to get to the most sensitive test to detect every patient with a potential fusion gene in their cancer. And fusion genes like NTRK, ROS, ALK, they're incredibly powerful drivers of cancer, and we have incredibly powerful therapeutics being developed and their companion diagnostics. So already we've gone from DNA-based small panels to DNA-based large panels to DNA and RNA-based. And I always think about it, while the RNA is being used to look at a DNA component, there's keen interest in moving to that RNA-based as a phenotype too. So you're not only looking at genotype and phenotype, and that's where you get into methylation for tissue of origin and to understand different processes going on within a tumor. You look at RNA for biologic processes, cellular composition, are there T cells infiltrating the tumor? And proteomics will be the next move to direct. So with that transition, we see more connection with the different therapeutic approaches. So you can just think about it, RNA now for fusions, for those directed, you get into what is PD-L1 expressed. You can now do that with a next generation sequencing based readout. And with biphasic antibodies coming, strongly into therapeutic, you're going to know what are the proteins being expressed. And so our vision is to make sure with the throughput allowed by the NovaSeq X, and the amount of sequencing each sample can be performed because of the lower input from the nucleic acids or the proteins, it really opens that up. And it's really Alex's teams that are making sure we have a pipeline coming in that for research and then moving into clinical. So maybe you hand it over to Alex.
Yeah, so great question, and something we think a lot about. And as Phil said, the science is driving us there, right? We're seeing these combined analyses. It's adding more value. It's interesting when you do proteomic analysis and you use that to kind of annotate the genome, it actually makes the genome even more valuable. So there's a real synergy. So it's not just extra dimensions of biology, additional sequencing. It actually makes every layer really more valuable. In terms of our participation in it, it depends. There's some places where we're doing organic things, other inorganic, or some combination, right? We're looking for those opportunities where we can accelerate things. There's something holding the space back. Maybe it's a piece of software. On Dragon now, we have single cell workflows, we have spatial workflows, microbiology, methylation workflows. And so those are places where perhaps there was a customer, a Dragon customer, who was having trouble getting into this field, and now we've kind of broken down that barrier for them. In some places like proteomics is a great example where we feel that the science is there, but workflows that really allow you to scale, to do huge numbers of samples, like our genomic customers do, we're not quite there yet. We partner with companies like Olink, who are also pushing in that direction. And we thought developing a product that you could run on NovaSeq X, where you could do hundreds of samples, you could do 10,000 targets a sample, and you had a Dragon analysis, that would be really attractive to those who we know are interested in proteomics. I hear about it from Susan all the time. But historically, most of the genomic folks haven't done proteomics, right? So we want to make it where it's kind of like doing large-scale genomics, and they have all those pieces, and it's straightforward to do, and the price is really attractive, which is also something we can do on for example, NovaSeq X.
All right. Go straight to the back here, and then I'll come up here.
Hey, RF Kareem from Ensemble Capital Management. I've got two questions. So one is on two sides of what you guys are doing. So one is, at last week's Genomic Forum, we heard a lot from various, speakers about how in the future, and really they see the value already, but they'd like to see genomics being adopted much more widely. So every newborn born would be profiled. Every cancer, no matter what stage, would be profiled. What do you think it takes to get to that point from a price perspective? Because obviously, I think you guys have talked about, demonstrating the value that comes out of it, right? So part of it is price point, and the other is the value that comes out of that information. And so really heading towards kind of ubiquity of profile of sequencing, and multiple times, and then obviously multi-omics, on top of that. But as you think about multi-omics on top of that, and that longitudinal sort of profiling over time, you end up with that data issue, right? And the fact that there's such decentralization of that data across different providers, even in, single payer systems, you may not even have the value extraction from the multitude of data and the volumes of data you'll be creating. So what are you guys doing or thinking about on that end of the informatics piece, which potentially could be just as valuable, if not more valuable, the sequencing sort of repository that could be built over time?
Yeah, maybe I'll start quickly, but then I'll turn it over to you, Phil, to talk a little bit about what, the acceleration and the breaking down of silos in the clinical market. I'll start by saying, though, that one of the things that was extremely exciting about the IGF last week was the participation of mainstream components of healthcare. So we had physicians there, for example. We had Minister of Health. We had people who run healthcare systems, and they were not only well-versed in genomics, which is different from where we were a few years ago, but they were excited about the potential for genomics. And it does mark, for us at least, we definitely saw a shift in the customer conversation we were having last week compared to even 2 years ago. I think part of it was just the education everybody got because of the pandemic around genomics. And so that's really exciting to see. And there was definitely momentum around the mainstream adoption of genomics into healthcare. So Phil, maybe you can talk a little bit about the price points, the breaking down of the silos.
Yeah. It's a great question, something we think a lot about, and certainly I think what I hope my presentation demonstrated is that there is a walk where for our sequencing to be incorporated into the fabric of a healthcare system, it has to bring value to the patients, and it has to do so in a way that provides health economics and efficiencies. And in fact, diagnostics, and I know Dan and Puneet know this, are frequently held to a higher standard where there has to be some cost savings. And what I would say is that a global truth is that most healthcare systems are not burdened by a little more expensive test or an expensive therapy as much that are effective and useful. They're burdened by ineffective, expensive therapy and tests. And so what we also know is the world's a big place, and just like ASCO and NCCN have guidelines based on the economies of countries, high income, middle income, low income, there will be price points that fit that elasticity that are different in different economies. What our approach has done over the past 10 years is brought sequencing down to become part of the fabric of, I'd say, high and some middle income countries right now. What the NovaSeq X does and what Alex's team will continue to do will bring it down into the middle and lower income countries. So we'll see that notch down as the different therapies come along with it, because as long as you're increasing your ability to take better care of patients and improving the efficiencies and avoiding patients getting ineffective therapy that's expensive, that'll drive utilization of our sequencing into these healthcare systems, and that'll drive adoption.
I'm going to come right down here to the middle to Tejas and then Dave.
Hey guys, thank you. Tejas Savant from Morgan Stanley. So two questions here really, Francis, for you, or maybe I'll start with Joydeep. Just to make more sense of the consumables elasticity framework that you laid out on that slide in your growth algorithm, Joydeep, can you give us a sense for what the split looks like today for you guys between genome, exome versus narrower panels, either in terms of runs or ideally both runs and revenue?
Yeah, I don't think I could give you exact numbers on that, but I will say, as Francis and several of us mentioned, right, we are very early in that curve, right? So if you look at the number of samples analyzed by smaller panels, right, by us meaning our own, even TSO 500 is considered today a larger panel, it's comprehensive genomic profiling, right? So we're very early in that, and that gives us that confidence that, as sequencing gets cheaper, as there's more and more science that builds up on this, right, that you start to see that shift, even in developed economies, right, to see that shift between more sequencing to more of these multi-omic analyses of these samples. And really that's using sequencing to open up a better understanding of biology and disease, right? So hopefully that gives you an answer to your question. Very early, but we see that shift, and we have seen that shift, right, from simple panels to more CGP, from even before that, right? I mean, just basic doing genotyping to doing more whole exome, and then, increasingly, I think Susan mentioned that on her slide, right? Even people that were very wedded to whole exome are now starting to talk about whole genome as a result of, some of the innovation and the disruption that NovaSeq X can drive.
Yeah, the significant majority of our revenue is not genomes. The significant majority. So that's a very small fraction. I'd say it's a small fraction of our total.
It's more than 10 to 1. Exomes to genomes currently, so there's a huge opportunity to convert, and just I think across the board for all of us, excitement and very explicit conversations about how the X can catalyze that.
And panels are even bigger than exomes.
Exactly.
So you're seeing panels, then exomes, then genomes.
There are only 4 million genomes sequenced, so that tells you right there, yeah, in history.
Got it. That's actually super helpful. And then Francis, going back to Grail here, as you think about that $78 billion oncology TAM that you laid out, how much of that would continue to accrue to you if Grail was spun out? Is it sort of 20% of that screening TAM that you would still sort of view as in sort of the mix? And secondly, and this is more really a philosophical question, when the Grail acquisition was announced, I mean, informatics and playing in key applications in a sense was one approach to making sure that you're not in the business of selling mainframes or computers 10 years from today. So how are you thinking about that problem if you decide to eventually spin out Grail?
Yeah, so let me take both of those questions. I'll say that our approach is going to be that if we don't have Grail, we'll look to participate in as much of that screening TAM as we can. And there are various options. So until we pick an option, I can't give you a specific answer. But clearly, we want to be the sequencer of choice to get the sequencer and consumable revenue across not just Grail, but anybody else who decides to go into the early detection space for cancer. In addition, we'd look for opportunities to participate more broadly, either through extending the workflow that we provide, to those companies through informatics, library prep. We'd also look to see if there's an opportunity to create a distributable kit, for example. To say, look, we're a fantastic partner for companies that have service offerings where we could create a distributed kit and make it available to the world through our commercial reach around the world into healthcare systems. And so we'd look for other opportunities to participate as much as we could into that TAM. And again, number of models that we're looking at, as we settle on them, we'll know the specifics. Our core business is a great core business, though. And to get to your second question, we're really excited about the fact that there is a huge untapped market in front of us that is very lightly penetrated. I mean, literally 0.07% of humans have ever had their genome sequenced. We're going to go from that to, again, billion humans having sequencing tests done on them multiple times over the course of that. We have orders of magnitude of growth in front of us in terms of the market opportunity. We have a very strong position, and our innovation flywheel is very powerful. And so, we're really excited about the opportunity in front of us as a core business to accelerate penetration into these very large TAMs. We have a good position. And on top of that, we see very, very attractive adjacent markets, cardiovascular, neurological, proteomics, that will continue to extend our TAM. And that's what gives us the confidence, as Jaideep laid out, to say for our core business, for what we do, we see an opportunity for long-term growth that is in the mid-teens. And so, that's what we're going to be focused on going forward. And we're fortunate that we have such a strong core business.
Okay, thank you. David Westenberg from Piper Sandler. So going on to the packaging, the cold chain, all that commentary there, can you talk about if there was any actual constraints on running run times of the actual machine, i.e. they weren't doing as much sequencing because they were spending so much time with all this ancillary stuff? And then you also maybe talked about some of the labor components of that. Is there any way to quantitate any kind of impacts in terms of runtime or labor? And if there is labor impacts, do you expect that to be deployed back into sequencing? And then can you just confirm that you're the leader here and your competitors also, you're not just late follower to the cold chain and some of the excess packaging, you're actually a front runner to that. So just want to confirm that.
So let's do this quickly. Maybe you can talk about what you've heard from customers. I'm sure we can all apply them that too, around the benefits of ambient chip and how it will stop them from disrupting. You talked about the example of people disrupting sequencing. So maybe we'll talk about that a little bit, and then you'll talk about other players and how this stacks up and how okay.
Yeah, I mean, it's definitely a big deal for our customers. I mean, if you looked at those 100-pound consumables, and if you're running fleets of instruments at full tilt, then kind of taking down your operation to receive these consumables, unpack them, get rid of the waste, is huge. So we expect that to be a simplification, cost reduction, labor reduction, especially at our largest customers, and space. I mean, they tell us wow, we have huge facility that we've built just to kind of to deal with the incoming material of that we need to run the lab. So I think that'll be a big simplification. I think secondly, building informatics into the sequencer is huge. And the amount of resource spent on bioinformaticians, a lot of customers can't scale their operation because of access to bioinformaticians. Secondly, the cost of storage of data is one of the most highest increasing costs in their operation. It's the storage of data is a bottleneck both in terms of cost and just either adding more servers if it's local or paying for it if it's in the cloud. So I think this is a huge simplification. It's not just that we're giving them a simplification and it's good enough. It's best in class and it's built directly into the instrument, and the footprint of data is much smaller, so your ability to take it to the cloud or what you have to store is much less. I think the turnaround time customers are asking, they're it's 24 hours, right? It's not is it 23 or is it they're really thinking about, they want to turn over to loading their sequencer again. So, and we're telling them, well, we think it could even be better than 24, and that's exciting for them. So I think these customers have maximized efficiency of human capital, of space, so they're really keen on how do they make the best use of their operation.
Yeah, I don't know if you were watching it, but the part of the presentation and that innovation room that got the loudest applause was when we talked about ambient chip. And
biggest prize.
It was far and away the biggest, and we did get customers again in tears saying this now enables sequencing to come to my country, right, in a way that it just couldn't before. But then, to the question you asked, there were customers in the U.S. who were saying, and I've actually been at a customer where they have these unpacking parties. They literally will stop the lab, take everybody from the lab, go down to the docks, and then everybody in the lab is responsible for taking out the consumables, getting the consumables back up to the lab. So it does actually stop the work happening in the lab in some labs, just when they have these big deliveries show up. It's less freezer space is required, which is money that can be repurposed. So it's labor savings, it's space savings, and I think it'll be one of the underappreciated big deals of what we delivered.
Yeah, and then maybe your last question, which is around the technology, right? So the XLEAP SBS, right, can be shipped, it can be, in a warehouse in the winter in Anchorage, Alaska, right, and then used immediately, or it could be sitting on a truck in the desert in Dubai and be used immediately. There's no other SBS chemistry that has that capability.
Nobody else can do
that I'm aware of, and it's 100% because of inventing the new chemistry. And I think I also mentioned we test it and see. If it was possible on the older chemistry, we would have done it. Right? And that's why it was a long-term dream, and that's why if you're using that older chemistry, it's a proven impossibility.
Okay.
I'm going to ask just one quick clarifying question from Vijay at Evercore. He's just asking on the margin question he asked earlier. Can operating margins get back to the high 20s in 2024 without Grail? So if Grail is not here, does that still work for the core business? The high 20s.
I don't think we've given any kind of
specific to 2020. Are you asking about specific to 2024?
Or, yeah.
2024.
We haven't given
Yeah.
specific dates like that, no. We've talked about long-term expansion. And everything we've talked about is without Grail.
Yes.
But we haven't given us.
So that's a point I think we should clarify. It's just all the long-term targets are core business only, and we haven't given longer-term view on Grail. So everything is just related to the core business. I'd like to ask one more, just to close this out, and really to Francis, if this is all right. So obviously we covered a ton of ground today. There were a lot of great things to talk about. So what should the audience, both here in the room and online, what are the big few things they should take away?
Sure. Let me start by saying that, we at Illumina are facing a very large and growing market opportunity, right? And it keeps growing as new areas of research open up clinical areas for us. We're incredibly well positioned, and get even better positioned with the portfolio that we released last week. But that's just representative of the innovation engine that we've built and the commercial engine that we've built. And those two combined position us very well, to go after that TAM. We have a number of sort of tailwinds, not just the TAM, but also our competitive position, the strength of our infrastructure around the world, the launch of an upgrade cycle right now, the accelerating penetration in the clinical cycle. That all combine to give us line of sight into a mid-teens growth opportunity, over the long term for Illumina, and that's incredibly excited, and we're very fired up about that because that moves us even closer to our mission of improving human health by unlocking the part of the genome.
Great. Well, I know we didn't get to everyone's question, so if you have a burning question, please send it to me. So it's sschwartz@illumina.com. Also online, we have your questions. Certainly get back to everyone that we can. I want to thank our presenters for spending time with us today. Hopefully you had a chance to learn a great deal about Illumina. It gave you a lot more to think about. And I want to thank all of our members of the audience, both in person and online, for spending time with us today.